Today's episode is about suicide. This episode is to all those who have considered a final good night, and also to all those who decided to continue the good fight. Because we understand that there are people struggling to navigate this thing called life. We know it's tough. You see, this episode today is for all those who have considered suicide when the rainbow is enough. We dedicate this show to those watching from beyond who decided to cross over the line. And likewise, we offer this episode to honor and support all those they left behind. Welcome to When Docs Talk, Unanticipated Goodbyes.
When dogs talk, when dogs talk, when dogs talk, when dogs talk. When dogs talk, 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 when dogs talk.
Hello, hello. We are When Docs Talk. As I mentioned earlier, we are talking about suicide today. We are giving a voice to a topic that so many people find difficult to discuss. For those of you joining us for the first time, we are When Docs Talk, a collaborative of medical professionals. We are doctors, we are nurses, we are all sorts of professionals within the field, and we come together to talk to you and talk with you. I am joining you here from Atlanta. I am Dr. Adidiang Ipe Apo. You can call me Dr. Didi. That's fine with me. Welcome, welcome.
Hi, everyone. I'm Dr. Sonia Pinson. I am a family physician working in the urgent care emergency room setting here, based out of Atlanta, born and raised here in Georgia, and also a Navy veteran, and just glad to be a part of this show with these wonderful, great ladies. So thank you for letting me be a part of this with you.
Hello, everybody. It's Dr. Yuli Harrison Lloyd. I'm a board-certified family medicine physician from New Orleans by way of Arkansas, rural Arkansas, Osceola, Belial, stand up. And I'm also working in an urgent care setting here in Atlanta, Georgia. And I'm glad to join these ladies and our wonderful guests this evening.
Well, thank you for joining us. As always, this is the crew from When Docs Talk. We've seen a lot, and we like to share our stories with you. By training, I'm an emergency physician. I'm also board certified in internal medicine, and I've worked in ERs throughout Atlanta, in Los Angeles, but I hail from Miami, Florida, by way of Niger. So shout out to the MIA and to Nigeria, Akwa Ibom State. I would like for you all to check us out on YouTube, Facebook, Instagram. We are there. So like, share, subscribe. We love to hear from you. And we thank those of you who have given us some suggestions as to what you want to hear. But as you know, we always start off with talking about what's going on in the world before we jump right into our discussion about suicide. So ladies, hot tops with the docs. What's on your mind? What's going on?
Oh boy. Y'all, I got a good giggle out of this. Y'all, this lady in Texas, she's pregnant, right? She was in the HOV lane. She got pulled over because it was just her. And she said, well, based on this Roe v. Wade, this baby is a person. This fetus is a person. So why am I getting pulled over? Y'all, I laughed so hard.
Well, I want to know, what did the officer say?
You know, I think they actually let her go.
I would let her go just out of the creativity alone, like that in itself.
I would let her go because she's pregnant and she's just trying to get somewhere. Can you let a pregnant lady just go somewhere? I mean, for real. Can we just get to where we're going?
I can see the officer now. Like, man, why were you in the HOV lane? Well, the fetus is a person too.
That's
right.
2, 1, 2.
There we go. Sonia,
Yeah.
you were telling me about something. What were you? There was a really interesting article that you were
So
telling me about. I couldn't quite believe it. Please share.
yeah. So yeah, I was looking through my favorite news site, TMZ. That's my reliable source of news. And so anyway, I was looking at they have a state senator from Rhode Island, Tiara Mack. So for her, she's doing a re-election campaign. And so for 4th of July, she did a TikTok video in which she's twerking, doing the handstand. So she is 28 years old, and so pretty much she was, saying, "Hey, come support me, and I'm pretty bad because I can do this." And so she's gotten a lot of flack from it.
Oh, wait, she was on a handstand twerking?
Oh yeah, twerking. Twerking. Working with your mama gave you.
That's how they do it in Rhode Island. Is that what
Rhode
they do?
Island. Yes, in Rhode Island.
Don't need no support. If
I
she's
didn't know
doing
they did that.
handstands, she don't need no support.
Exactly. Well, yeah, they do it like that in Rhode Island. So it was just from the standpoint of the dynamics, though. Some people, and it really depends on how you look at things. So she's 28. She's saying, you know what? I'm showing them I'm a politician. I can be free. I'm a person too. I have personality. But some people are like, you know what? Is that being tacky and classless? But for her, she came out and said, you know what? Really, even if people had a problem with me, they didn't agree with it. People were coming out because she was Black and saying derogatory.
Oh, she's black. She's black.
She's a Black. Yeah, she's a Black woman, Black young female, as well as she's homosexual. She's a lesbian. Well, she's not. Once again, she's very proud of all of this, but it was just she was very hurtful, at least from the statements that I was reading, that, you know what, out of everything, that people were really going at her because she was Black.
I see.
And so I think that was the thing from the standpoint of, yeah, you can say it was comical. But then again, also it's like, wait a minute, why can't this young woman, even if it was a mistake or not, can't she just be who she is? And not
I hear you. And that kind of came up, honestly, Sonia, that's come up in the medical field too. I don't know if you remember, was it like a year ago or something, where there were some doctors who were in bikinis, physicians, and they were given flat, like, how could you be wearing a swimsuit and you're a doctor and so forth? And so the question comes up, like, is there a dress code when you go into a certain profession, on your own private time? Clearly, we're not wearing bikinis in the hospital, okay? Exactly. It's not happening like that. But on our own personal time, why is it inappropriate for us to wear certain clothes? And I feel like it just brings up the whole issue of women and the policing of our clothes, whether we're in work or out of work.
Absolutely. And the thing is too, I feel like everybody is entitled to their own opinions. But right now, I tell you, people get so ruthless. And then also you get to hear those opinions now on social media. So when you get on social media, it's one thing if you're like, I don't care what people say, but now they like writing it, you're reading it, and it's there.
Oh yeah. So, and some of them are taking a step further. They're getting really aggressive with their comments. So if they find out any way to contact you, they can actually direct message you and really become almost bullying in a sense.
Exactly.
Is what a lot of people are complaining about.
Yeah. So and from all those different angles.
Yeah. Well, I wish my story was as exciting. I gotta talk about COVID, y'all. That's what's on my mind. That's what I was reading in the news. So for those of you who have been along with us for this journey, you know that we were talking a lot about COVID in the early stages of When Docs Talk. And I wish we could put COVID in the backseat and keep it moving, but that's not really what it is. As many of you know, wherever you're watching us from, COVID is still alive and real. A lot of people are seeing a surge, which some people are referring to as the silent surge of COVID. But the truth is, I was reading an article where a lot of experts are saying this is really not a new surge. Ever since Omicron hit late last year, the numbers never really went down. And now we have variants, of which the most common that we're seeing are BA4 and BA5 circulating. They are subvariants of Omicron. And we're finding that, unfortunately, even if you have been infected already with COVID in the past, or if you have had the vaccine, there are people who are still getting it. I know people who had Omicron like legit 4 months ago, and they've tested positive again. So that's the bad news, everyone. But the good news is that the vaccines are still working to help prevent severe infection. So we are not seeing, at least in my practice, I'm sure you guys can, chime in and let me know what you're seeing. We're not seeing what we saw a year or a year and a half ago, where people come in all ages and they're just dropping their oxygen levels and we have to, admit them to the hospital or even intubate them. We're not seeing that as much. And I think that it's because the vaccine did what it said it was going to do. Remember, it didn't say it was going to prevent COVID. or completely eradicate COVID. What they said is that it was going to decrease deaths and hospitalizations, and we're seeing that. So what can you do if you feel like, gosh, I just got over this whole COVID thing. I'm living my best life, trying to enjoy the summer. How can I protect myself from going through the COVID blues again? So I think it's a personal choice at this point for what people want to do and what level of security they want from the disease. We still advocate for the vaccine. We advocate that you get vaccinated, get boosted. Everyone in my household is vaccinated, except for my youngest, who's 4, but the vaccine has now just come out for those who are in that age range, so he will be vaccinated. Consider masking. We talked about masks a lot on some of our past episodes. We do know that they help. A lot of people are not. In a crowded setting, I still mask. I mask indoors. I don't really keep my mask off unless I'm around like my household, my family. When I'm going out, I still mask, particularly when the numbers are high. When the numbers were a little lower and I didn't see as many cases, I did sometimes relax the mask thing a little bit. Consider it. Also, it's summertime. I know it's hot as heck wherever some people are, but outdoors is really the way to go. It's not that you can't get COVID outdoors, but it's a lot less easily transmitted. So outdoor activities, masking indoors. If you feel sick, oh, I have a little sore throat. Oh, it's my allergies acting up. Please get tested, because if I had a dime for every person who has told me, oh, it's not COVID, doc, it's my allergies that actually ended up being COVID, we might maybe not need to even do this show. So this is the thing. Protect yourself, protect others. If you're around people who are vulnerable, older people, people with asthma and comorbidities, you definitely want to make sure if you're feeling sick, stay away. Trust me, they don't want you at work getting everyone sick. So that's all I have to say. That's my story. It's not a twerking story. It's not a lady who's in the HOV lane trying to, prove a point, but it's a story that I hope that you guys will take to heart. Have you guys been seeing a lot of COVID?
Yeah. I don't know, for me personally, I do feel like I've seen my own little surge in my circle. Yeah. And then when I'm at work and that kind of stuff. But you are correct. We're not seeing the severity. So it's very virulent still. So it is passing really, really rampantly. But yeah, not the severity. Which is good because, I definitely do not want to go back to those days.
I'm definitely seeing more of it myself. I have, thankfully, knock on all sorts of wood, I have not gotten COVID, and don't want it. My family hasn't gotten COVID. I've got 2 little ones, the 8-month-old and the 3-year-old, and they are definitely getting vaccinated. But COVID is alive and well and kicking and having a hot girl summer and trying to ruin yours. So
That's right. All right. Well, we're going to switch gears a little bit. Thank you for those who have joined us so far. I see about 800 of you on. Definitely feel free to post any questions or comments. We want to hear from you. But we're going to go into our next segment where we talk to you a little bit about what we came here to talk about, which is suicide. Okay. All of us have personal experiences with suicide. Thank you, Elizabeth Cerny. We appreciate your comments. I just want to throw up a little bit of information about it before we share with you what we have seen. Okay. So suicide in this country is the 12th leading cause of death. And in 2020 alone, over 45,000 Americans died by suicide at an average rate of 130 deaths per day. In 2020 also, over 1.2 million Americans, or I should say a million people in America, attempted suicide. We know that women are almost 2 times more likely to attempt suicide, but men are almost 4 times more likely to actually die from suicide. So there's that distinction between attempts and death. Suicide rate is highest in middle-aged white men. We also know that firearms, something that we've discussed a lot on our show, accounted for almost 53% of suicide deaths here in America in the 2020 data. 90% of the suicide deaths had a diagnosable mental health condition at the time of their death. 10% of adult Americans have thought about suicide. 10%. And I think that number could actually be underestimated. 54% of Americans have been affected by suicide in some way. And 93% of Americans surveyed in 2020 think that suicide can be prevented. Ladies, tell me a little bit about your thoughts on this matter.
Well, I think, you know, it's something that it's really no something that a lot of times people don't want to talk about, but it's there. And now, I don't know, for me, I feel like it's more prevalent. I felt like it was here and there, and you would hear of people committing suicide, and but it was never you or never really anyone you knew, and that kind of stuff overall.
Sure.
um, you know. And so for me personally, I don't know, people that know me, my sister died June 1st of last year, and she committed suicide. And, once, she had her issues, and those are hers, those are private, but she decided to do something to end how she was feeling. And, never knew quite, from the standpoint of thinking about, she had done some attempts or thought about it or had articulated, but never thought that she would go through with it. Because once again, never thought that it would happen to me. It would
Right.
never happen to somebody that I specifically know. I've had a cousin that had done it, but it was them, not me and anybody that I was close to. And so then it makes you kind of, when it gets to you personally and within your own sphere, and you think about what is somebody thinking that they would want to end their life? Like what kind of pain, whatever thing, anything that they were going through that they felt like that was the only answer. And you wish that you could help them. You wish that you could do something about it. And ultimately that person decides what they feel is best for them. But then again, what can we do to make people not feel that is their only answer? That
Yeah.
that's the only way for them. And I think now there's a lot of people out there, the way things are going, when it came to COVID,
Yeah.
isolation, and then economically, when it comes to jobs, I think a lot of people, even if they had not done it, they're thinking about it. Or
Yeah.
maybe that's their answer.
Yeah.
And then even people that you wouldn't even think. I mean, just think about all the celebrities recently
Oh yeah. Oh yeah.
who kill themselves. And once again, they're thinking that the only answer that they have is to kill themselves.
Is to kill themselves.
Yep.
And I'm so glad that first of all, thank you for sharing what happened with your sister, with our viewers. I know that that was very, very difficult and still is difficult for you. You mentioned about the pain, and you mentioned also about the celebrities. And I think that it's a really important point, because a lot of people have this misconception that if you have, money or fame, or so many people love you and everything seems to be going well for you, that that's not something that would ever be a thought. And I think we've seen so many instances of situations where that's just not the case. We've seen sons of celebrities. We've seen former Miss USAs.
Yes.
Yep.
This is something that affects everybody of all walks of life and all ethnicities.
Yes. Yeah.
I feel like
You guys immune to it.
No.
Go ahead, Dylan.
I was just going to say, I feel like, especially in the African American community, I feel like that there is a stigma attached to it because it will be swept under the rug of religion sometimes.
Oh, absolutely.
That they'll tell someone literally to sleep it off, or just to pray about it. And if that's your thing, that's your thing. But sometimes more intervention is needed. I've lost some people really close to me. One of them being my intern, one of my interns, my second year of residency. Um, I saw him while I was getting ready to go on vacation. Asked him, was everything fine? That was a Friday. It was great. I actually flew to Guam, had a great time, came back in a week, and they told me what happened. And I was like, I would have never thought that this guy who just smiled in my face and everything was fine would have done this.
Yeah.
It sneaks up on you, and that's the best way I can describe it. It just sneaks up on you.
And I know, and I'm so, and I'm looking forward to the discussion that we're having with our experts, because I think you hit on a lot of points, Yolanda, from the standpoint of even when it comes to religion, and especially in our community, from the standpoint of, is it something that, which we do need to discuss, and seriously, from the standpoint when people feel bad or if they feel depressed, like, it's okay. That's not a character flaw.
Right.
And it's okay to feel hopeless and overwhelmed. It's not a matter of toughen up, suck it up. No, it's okay, and to discuss it and talk about it.
Yes.
As well as, also, it was interesting. I've heard some people. I'm religious. I'm Baptist. I'm a Christian. But from the standpoint, even when my sister committed suicide, I had issues talking about it because I was concerned: are people going to say, "Oh, she's going to hell because she killed herself"? Is that the ultimate sin?
Right.
And of course, for me, no, I'm going to see her again. My beliefs are that, because of our beliefs, I believe that I'm going to see her again. And this is just, she was hurting and she needed to go. And I feel like she's somewhere that she feels better and she's at peace.
Amen.
And so, but I think that's part of this discussion that hopefully, when we discuss it with our experts, that we're going to discuss stigma.
Yeah.
What's keeping people from going to get help, as well as those discussions, even with family members afterwards. How are they dealing with it?
Absolutely. There is a lot of stigma. I know that people have a hard time discussing it for so many different reasons. I see here E.M. McCribb is saying, yes, depression is not a character flaw. I'm not Black myself, but that's something in my family as well. People are scared to even talk about that their family member committed suicide because they're scared of the judgment that others will have for that loved one, even outside of religion. Because aside from, that was a sin, you also hear things like, that they were weak or they couldn't handle it. There's a lot of negative judgment that people have towards people who opt for suicide. And so that's part of our discussion, is how we can destigmatize it and what kind of ways can we talk about it more? And is it worthwhile to talk about it? That's another thing we'll talk about. Because there's some people who think that we shouldn't because it encourages it. But that's definitely one of the myths that I hear out there.
No, and that's a great point to bring up, because I would never, in my discussion or even thinking about it, I would never think that anybody would, if we could save a life or help somebody.
Well, some people think that if you talk about depression to a depressed person, suicide, you're giving them ideas. That's what we've heard. But I don't want to belabor the point. I mean, I really want to get into this, continue this discussion with some of our experts. We have a lot of great people here to share their expertise and their personal experiences with us. I want to say that suicide has touched all of us. When they did a poll of Americans, the vast majority, almost 70-something%, feel that suicide has impacted them one shape, way, or form. I have had people in my family attempt suicide. I have had friends who have committed suicide. Suicide is something that you're not going to escape. And even professionally, I've had patients who have attempted suicide during that ER visit. There was a patient who went to the restroom and found a way to hang himself. And the only reason that we knew that he was injured is because the pipe that he hung himself on broke, and it released all this flooding. And so when we finally went into the room, we were able to find him. So we had to go from one section of the emergency department, the psychiatric section, to the trauma section, because we had to evaluate his neck. So it is prevalent. We hear about it a lot. And so before we bring on our guest, for those of you who are just joining us, I want to remind you that there is a National Suicide Prevention Lifeline. They are there available 24/7. You can call the number on the screen or even text TALK to 741-741. You are not alone. Without further ado, though, I do want to bring on our guest. And our first guest is actually someone that we've had on When Docs Talk before. We're so excited to welcome back Dr. Erica Goodwin. Dr. Erica Goodwin is on a mission to help you be better, do better, and live better. She is a Harvard-trained, double board-certified psychiatrist, best-selling author, top-rated speaker, integrative lifestyle coach, and creator of the hit podcast, Better with Dr. Erica. She is a graduate of Spelman College and Emory University School of Medicine, and also completed her general psychiatry residency at Morehouse School of Medicine. Dr. Erica works with organizations and high-performing individuals who are stuck and want to get back to getting better results and living a better life. Within a few moments of being with Dr. Erica, you can see why executives, leaders, and entrepreneurs hire her to get to the next level. She takes Ivy League strategies and simplifies them into easy to use for everyone to relate to her story. Dr. Erica is known as one of the few medical professionals who will tell you what they don't tell you, but you really need to know. Her evidence-based methods go against the grain of common myths about success that sound good, but don't really work. She will show you and your organization's secrets used by some of the world's greatest achievers and translate them into practical steps that can change your life forever. Dr. Erica's story is proof that when you know better, you can do better. And we are feeling better just for having us here or having her here with us today. Dr. Erica, welcome back.
Hi, thank you so much for having me. It's such an honor.
Thank you.
Thank you.
All right.
Okay, so I have the pleasure of introducing my friend, Dr. Jonathan Orr, a PhD. So he's an associate clinical professor and the program coordinator for the Clinical Mental Health Counseling Program at Georgia State University. In these roles, he has trained and supervised psychologists and counselors for over 17 years in the field of counseling psychology, school psychology, mental health counseling, school counseling, and rehabilitation counseling. He is a licensed professional counselor and approved clinical supervisor who is active as a practicing clinician. In addition to this time at the Georgia State University, he owns Breathing Space Counseling and Wellness. And it's a private practice dedicated to working with a wide range of clients. He also trains, consults, and supervises psychologists and other professionals in the practice of group psychotherapy and counseling interventions such as narrative exposure therapy, focusing, and mindfulness-based interventions. In addition to his private practice, Jonathan also consults to professional and community agencies related to the topics of interpersonal dynamics, traumatology, and diversity and inclusion. He is also a project director for multiple mental health initiatives within refugee and asylee communities in Clarkston, Georgia. And these projects focus on training lay counselors in narrative exposure therapy so that they can begin to heal trauma in their own communities. He's also served as president of the Association for Specialists in Group Work, a professional organization dedicated to the practice and scholarship of group and interpersonal dynamics, and served on the governing council of the American Counseling Association in the U.S. He is also a member of the Vivo International. It's an NGO organization that aims for research, prevention, and therapy of the consequences of traumatic stress on violence and conflict affected individuals and communities. So Jonathan, when we were asking him about joining us on When Docs Talk, he was saying that he wanted to join the conversation because suicide is a complex community mental health issue that is heavily laden with stigma. It is often hidden and misunderstood, which leads to further avoidance or denial. The more time we take and dedicate to addressing this topic in an open and direct way, the closer we can be to reducing barriers to support and treat for those contemplating suicide. So thank you very much, Dr. Orr, for joining us.
Thanks for having me. It's a pleasure to be here.
Thank you,
for
Dr.
coming.
Orr. Thanks so much for coming.
Amen.
I have the pleasure of introducing Walter D. Moody, also known as Moody. Walter D. Moody is a father, activist, artist, and published author of the suicide note turned book, Moody Was Here, Amid a Manic State. Walter penned Moody Was Here, a book journaling his thoughts as he went face to face with 2 years of suicidal depression during the pandemic. The main character of his own story, by way of Oakland, Mississippi, Moody is an advocate and community organizer for social injustice and mental health while serving as a private wellness consultant throughout the Southeast region. As a graduate of Arkansas State University, Moody is not only a student of life to those he serves, but a father to his 6-year-old son, King Moody. And in his latest project, Moody Was Here podcast show, Moody provides safe place and platform for those struggling to continue to live, as well as highlights those who have testimonials that inspire others to keep living. The witty and surprisingly comical sketches bring a new meaning to the phrase laugh now, cry later, by capturing his humor for life and all that comes with it, while reminding people to laugh 3 times before noon in honor of his late aunt, Dr. Carol Gary. Lastly, the words he initially wrote to leave this world have become his mantra and the fuel behind the Suicide Man mission in the mental health community. By turning the can'ts into cans, Moody writes and assures us all that together we can survive in this world much longer and our minds can get much stronger. Moody was my fitness coach, my trainer when I was in residency, when I was much bigger than what y'all see right now. And I am so happy that this man has entered into my life. If there is a higher power, this man is proof of it. Get the book. And also, Moody, I told you I had a gift for you, baby. Straight from Blivel. I got you a nice wire hanger.
Oh my God.
Right here for
One of
you.
the biggest inside jokes that have never died down between us. I love it.
Oh, it's definitely inside. I'm like, Mike, we're so excited to have you, Moody. Thank you so much for being here.
Oh, thank y'all for inviting me in. I love it. Thank you so much. I tried to get on Strayer University last night to give me some credentials and get up with you guys, but they weren't gonna let me be a doctor in 24 hours. So I said, you know what, I'm just gonna show up.
We're gonna give you some degree before you leave here. Don't worry.
I love it.
All right, let's bring on our final guest. I have the pleasure of bringing back to When Docs Talk Dr. Uduak Afangide, who is a licensed professional counselor and founder and CEO of Afangide Therapy. She is also a professor at Faulkner University in Montgomery, Alabama. She also taught at the University of Calabar for 15 years and then relocated with her family to Montgomery, Alabama, where she has been teaching for 13 years in the science department. She is the immediate past chair of the Department of Natural and Physical Sciences. Dr. Afangide felt the need to invest in the mental well-being of students, which prompted her to seek a degree in mental health counseling in 2017, and ultimately to found Afangide Therapy. As an advocate for mental wellness, she states, the goal at Afangide Therapy is to destigmatize therapy among people of color, and we have various initiatives to make that happen. She is the author of 5 books, including a textbook for non-majors biology used at various universities in Alabama and Tennessee. Her latest book is My Therapy Notebook, a companion on your mental wellness journey, published just this January. An advocate for trauma survivors, in our episode on gun violence, Strapped, she spoke with passion about us needing to be a voice for those who are struggling to find their voices. We are so honored to have her back with us. Please help us welcome Dr. Uduak Afangide, who we affectionately call Dr. A.
Hey.
Good to be here. Hi, everyone. Thank you for having me.
It's so nice to have you back.
Good to be back. I think this is an important topic, and I'm so glad to be part of the conversation because it needs to be had. The conversation needs to be had.
Absolutely. Absolutely. So I just put a little note to our viewers. We want you involved in this discussion. Thank you so much for those who have commented already. Let us know if suicide has impacted you in any way, shape, or form. Type yes, WDT. But let's get back to the discussion while we have our viewers do that. I want to start out by asking our guest, and we can start with any of you, but I want to know your personal experiences with suicide. I know that you have professional experiences with suicide, almost all of you, if not all of you. But tell us how suicide has impacted you personally.
All right, now one at a time, guys. I'll go ahead and go. Everybody calm down. Everybody calm down real quick.
I was actually hoping you would
I
go
couldn't
first.
find my trackpad. I was trying to unmute myself. I wasn't hiding, Moody. I wasn't hiding.
Okay, most definitely. I'm quick to call somebody out for certain now. Most definitely, like I said, I want to thank everybody. Thank y'all for just having me here tonight. I'm definitely intrigued about where this conversation will go. Like I said, I've had my own personal experience with suicide. It was one of those things that I definitely didn't see coming, and I'm not sure if anybody ever sees it coming whenever it comes down to it. Mine started, I guess, I would say definitely during the pandemic. As you know, most of us were like in quarantine, in isolation. So it's one of the things that we found out how much of ourselves that we had to learn about ourselves honestly when being in that time alone. And for me, it was one of those things that was a graduate, a slow graduate increase as the days went by. I can't even tell you like exactly the day or what event just kind of like triggered by any means. It was kind of one of those things where I went through some changes in my family dynamic. I went through some changes when it came down to my financial situations as well. So it was just one thing after another. And then just kind of one day I woke up and I was like, man, I'm feeling something that I never felt before. I'm like, what is this? You know what I'm saying? And as you can guess, I'm always kind of being one of those guys that's joking all the time, always happy, always the one that's like, making sure that the room is full of like joy and laughter. And it wasn't there one day. And I wasn't the one to able to like pull myself out of it. And I got to the point to where I was like, man, you know what? I'm like really tired of just like, being here, in a sense. I've never been one to like just kind of be prolong things. It's like whenever I identify something, I'm like, oh, I'm depressed. Oh, I'm suicidal. What are we going to do about this today? You know what I mean? So that's when I really kind of got into that mindset or whatnot. And honestly, like I said, I've always been one to also try to put my best foot forward. So I started to also try to look at for as like identifying before I decided to, if I wanted to leave this world, all right, obviously I'm not happy. So I want to be happy again. And then I realized I was like, I don't even know what makes me happy. The pandemic made us spend a lot of time with ourselves. I had the opportunity or the pleasure, the luxury of being busy all the time. Yeah. So when you're busy all the time, you don't have to look at yourself a lot of factions. You don't have to do a lot of self-care, self-work in that regard. So I just woke up one day and I was like, all right, before we go down this road, and it was a real road. I was like, all right, let's do the work first. And I'm always one to like try to put my best foot forward and put that work in. So I asked myself, what makes you happy? And I couldn't think of nothing at all. And so it took me a little bit of time and sat with myself. And then I realized I was like, okay, we're gonna have to keep going back a little bit further, because everything that I associated with happening wasn't there anymore. And it wasn't gonna be there anymore. Whether it was people that had been in my life who had gone, or there was things in regards to like my professional career that's not there anymore. So I'm like, all right, we got to keep going. So eventually I landed on just finding the opportunity to just go back into my childhood. And that was one thing that I didn't never even realize that plays such a big factor. You hear people talk about like, trauma starts in certain different areas in your life and you hold on to different things. And it's like one of those things that I look back at my childhood where I started realizing that a lot of the things that I was struggling with came from just like abandonment issues when I was dealing with my dad, you know what I'm saying? Him just not being around, that was one of those things for whatever reason, it just like hit me overwhelmingly or whatever. And it got to the point to where I started just thinking like maybe there wasn't anything that was going to make me happy. But I decided to just kind of like really put that happiness to rest. I was like, there's nothing that's going to make me happy. There's things in my life that still are constant from since I was a kid. So it's like, why would I even think that here I am at this age right now that there's going to be something that's going to change? And my story, like I said, it got very deep, in myself. Like I said, I talk about it in my book, and I really just start to write down everything. And I'm a very, very passionate person in everything I do. So whenever it got to the point that I wasn't comfortable with my life anymore, I was passionate about it. I was passionate about how I was going to leave this world. I was passionate about like making sure I was prepared to leave this world and everything that came with it. So for me, it was going to be one of those things where it wasn't going to be a big hoorah. It wasn't going to be nothing that was going to be out of the ordinary. It was going to be a normal day. And one day it got to the point that I was fine with it. I was heading down to Mississippi. I had like decided I was just gonna go stop by my mom one last time, just to go just stop in, see my mom, see my dad, and then I decided like I was just gonna figure out what it was gonna be next after that. I'm really one of those guys that you kind of just go with the flow type of deal. And like I said, who I was in my real life and my characteristic was who I was in those moments. I was like, I'm not going to overthink this. I'm just going to kind of be spontaneous, go with the flow. If today is the day, then I'm like, yep, today is the day. So that day in particular, I drove down to Mississippi, and I'm probably like 10 minutes away from my mom's crib and like that. And I decided to call one person. And it was this one person who I decided to like reach out to for whatever. And to this day, I don't know why I called that particular person or whatnot. And I had I used normally kept like a knife on me no matter what, typical country guy stuff or whatnot. So I was like, I can get this done real quick, make it real neat. And that's the thing about me. I don't like people had to like clean up, certain things after me. I mean, I say I don't like people cleaning up after me, but I'm sure my girlfriend can go against that. But I like to be trying to neat, keep things, I try not to be a house for people. So I was like, I'm just going to kind of get it done nice and neatly. And I called this one person and I told them kind of like, what I was about to do. And they were too busy. They were about to go on a date. So, and honestly, for whatever reason, you would think that would like drive me to the edge or like, damn, I'm like, my life wasn't even important enough for you to like just stop, change your plans up or something like that. But for me, for whatever reason, they're just like, all right, today is just not the day. I was like, here I am looking at myself, what are you searching for? Why did you call this person? What are you searching for in other people that you can't find in yourself? Why did you feel like you need that call? Why are you going down the things that are the most cliche? Let me get that phone call. And I realized in that moment that I was following a pattern. I wasn't like being myself. I was doing what everybody else was what everybody else would normally do. And that's something about me I don't normally do. So I end up coming back to this house and I started thinking about that question again, what makes me happy in it? And as a kid, I remember just like, I loved like spending hours and times of like just drawing and art and whatnot. And so I just got on my wall that's behind me.
Yeah, I can see.
And I just started drawing. And like each day, whenever I start feeling a certain level of depression, I just got on the wall. I just draw and I invite people over. I'm like, let's get on the wall and keep drawing and like that. And it was definitely a tough time each time. Every day was tough. It was never a day that I was like comfortable with the fact to tell everybody like I was okay or nothing like that. And even to this day, as I'm sitting in front of you right now, I can't even tell you 100% that it won't cross my mind again because it might, you know what I mean? And like I said, depression comes in spouts in different times. So for me, my suicide story definitely is a one that's sporadic. It's not one that would have like a definite day or a definite certain type of event. I can list a bunch of things that went into my mental state whenever I was going through it. But at the end of the day, what matters, I'm living in it now. I'm here today. And that's all that matters for me. So my suicide story is a continuing story.
Well, thank you so much for sharing that story. EM McRib is saying, this is so powerful. I'm trying to put this up here. This is so powerful, Moody. Thank you. I think that your story is even more powerful because it's going to allow people to know that they're not alone. Your story is unique, of course, but it's not unique in a sense that you're the only one who has considered it, especially during the pandemic. As I was looking through some of our stats, we see that there was a sharp rise in suicide and depression and anxiety during the pandemic. I want to throw this question up here. How can we tell if somebody is thinking about suicide? Because I'd like some of our experts to weigh in about this, because a lot of people feel like they want to know how they can help somebody that they're worried about. Are there warning signs?
Jonathan,
I'll start with a really simple thing. The way you know is by asking. Just to be really direct with people all the time. And part of, I think, reducing the stigma is to make it a conversation that's not reserved for like scary times or this is the end conversation we should have with someone. It really needs to be a beginning conversation that we have with people all around us, loved ones, strangers on the street, just to work it into our everyday language and our everyday conversation, just to talk to people about that.
Well, what does that look like, though? I guess from the standpoint, I think, really it's so hard a lot of times when people are running around. And once again, from the standpoint, we all have to kind of put on a certain face.
Oh, yeah.
And how we're in our jobs, with our friends and that kind of stuff. And so how do we create a dialogue where we're open to discuss these things? I mean, let alone even if I'm having a bad day and I feel bad, but then to that extent that I can feel, open enough to talk about if somebody was going to harm themselves.
Definitely.
I think it starts with just engaging in a conversation about how are things going. You started out a wonderful conversation today about little news blurbs. That can be a segue into just talking about someone's experience. How's the pandemic been for you? What's been your experience of it? We can have these conversations in grocery store lines. We can have them like hanging out on social media. We can do these kinds of things. And then just really broach the topic of like, hey, sometimes folks can feel really, really low. And when they feel really low, have an option of like harming themselves. And are these thoughts that you're having, or these things that you've ever considered? And it's an awkward conversation. I'm not saying it's really easy or sophisticated. I mean, I do this for a living, and I still stumble with these conversations with people. So sometimes just asking really directly, do you have thoughts of harming yourself or hurting yourself? Can we talk about this? Ending your life? Do you ever wish you weren't here? Do you ever feel like you're such a burden on people that it'd be better off without you? Those are all kinds of coded ways of talking about suicide or stating suicidal intent.
So just kind of closing the gap on silence, maybe, because there's so much isolation. It sounds like you're just saying, it just starting off with a conversation in general, maybe not about suicide, and then kind of going into it slowly. Is that what you're suggesting, Dr. Orr?
Absolutely. Yeah, to decrease, I think the piece with COVID too is exacerbated. And I heard some of that in that movie. Thanks so much for sharing your beautiful story. It was really powerful for me to hear. But that piece of social isolation is a huge indicator of suicidal ideation. When somebody feels excluded, alone, isolated, they don't have a sense of belonging or connectedness. And so, sometimes just a conversation with someone to say, I see you. How are you doing today? It seems like you're having a rough day. Let me pick up that for you. Let me help you with that. Kind of just getting those, the social connection that we've lost, I think, with COVID. And then also some of the climate that we have around how people talk to one another, the way we interact with each other in conversation, that we've created more distance than closeness.
Thank you. Any other warning signs that some of our experts can weigh in on?
I'd like to. But I also want to piggyback on one thing that Dr. Orr said, and I'm so glad you brought this up, is when you're having some of these conversations, and I noticed Dr. Pinson mentioned this too, is kind of how do you do this in the midst of running around and being busy? Part of the key of having these conversations is at some point we all have to stop. Because you have to it's two things, intention and being present. And it's hard to have these conversations if it's in the midst of running through things, and people don't necessarily feel like you're present enough to have that depth of conversation. So one is just making sure that when you're having these conversations, that you're actually present, because most likely someone's not going to open up to you if you're not present. The other thing is, I want to go just a little bit deeper into, in our clinical terms, we talk about helplessness and hopelessness. And that's where you get to the part that Dr. Orr was talking about, kind of what is it like if you're not here anymore? Do you think about not being here anymore? So if you hear people start saying things like, it doesn't matter if I'm here, nobody loves me, nobody thinks about me, nobody sees me, or they're giving away things, or you notice that patterns just are totally changing dramatically. You have someone that was social or used to talk to that's not talking to anyone and is totally isolated. And I know we've mentioned depression a lot. The other thing is there are other kinds of mental health conditions that can have higher prevalence of suicide. And I don't want us to lose, especially given the pandemic, the increase of substance abuse.
Oh, yeah.
So also, if you notice someone is just really struggling, they're, they could be smoking weed or having edibles all the time, or they're blacking out, or, they might be using a little cocaine or something else. But just if you start noticing these changes and this seeming just kind of lackadaisical or not caring, that can also be a sign.
Thank you.
I want to definitely piggyback on that as well. Like I said, the signs are somewhat are there, you know what I'm saying? For us, looking for the signs, you got to actually look, you know what I mean? It's like sometimes they're not as hard to see, whether it's, like you said, substance abuse, or one of the big things for me that I know is that weight loss, or something like a change in fluctuation in weight and everything. Is for me, I got super small, mad small, like I said, and so many people are so used to me looking at me a certain type of way, being a fitness professional of that sort. So whenever I start losing weight, I'm like, I know y'all see me over here looking mad small or whatnot. So, but they would have to look. And even the ones that look, they might have turned a blind eye to it. It's a tough conversation. Like I said, like Dr. Orr said, you got to be willing to have that conversation. And that's tough. If I'm coming to the doctor and there's no help. There's no help for me if I don't tell y'all and show y'all where it hurts at. You know what I mean?
Yes.
If I just walk through the door and just like, yeah, I'm hurting, and you ask me where, and I'm just, I'm not telling you anything about my symptoms. So, but at the end of the day, it takes the communication on both ends. There's different signs. And, like you said, the substance abuse is one of the biggest things. You see someone who's doing something different than what they normally do, just going down a pattern. Because at the end of the day, it's not necessarily that people just want to die. They just want to get rid of the feeling. And everybody knows that, like, that feeling of certain things, you want to just kind of get rid of that feeling. When you see someone chasing that high in a certain sense and whatnot, just kind of get rid of those feelings. That's really the big sign. But honestly, it takes a lot of just like looking. Certain things that you see in a person, no matter how good they got it together, you can tell when they're different. It's like it can be the slightest off. You like something is off about you. You can always, for me, I can always kind of tell when people invite death in their life a little bit.
Yeah.
Like if they're carrying it for someone else, or even if, like I said, it could be their own. But it's something about when the death is in you or around you or in your family. It's like you can see it, you can smell it, and it's one thing. But it still comes to the person that. In your circle, you got to look at it, and that's something tough to look in the eye. Are we, everyone sitting here, everyone that's on this video, are you prepared to look death in the eye? What I'm saying? It might be your own death. It might be somebody else's death that you see, but being able to look that in the eye, just being able to like say, hey, let's just have a conversation. Don't turn it the other way. Don't just chalk it up to, oh, they must be on a different weight loss plan and you haven't seen them.
Right. Say something. Basically, say something. And it's hard. It's easier said than done because people also don't want to offend people, right? You don't want to offend your loved ones. You don't want to offend your friends. Sometimes it's somebody who's in an authority position for you, and you don't want to offend that person or get them in trouble. Is another thing that I hear about. But just to kind of, answer the question even a little bit more, because you all have so eloquently answered it. Talking about wanting to die, that's a hallmark that should be taken seriously. Talking about feeling hopeless or having no reason to live. Talking about feeling trapped or feeling like there's no way out. There's no solution to my happiness. I think, Moody, you were saying that. Feeling unbearable emotion or physical pain, or talking about being a burden to others, I think somebody else has mentioned. And also the withdrawal from family and friends has also been mentioned. That is another potential warning sign. Giving away important possessions. All of a sudden, things that mean a lot to this person, they're giving it away. You have to ask why. You have to wonder why. And saying goodbye. There are some people I've spoken with recently who mentioned that they felt like they should have known something might have been wrong when their friend that committed suicide said, "I love you." And it just sounded so final. Putting affairs in order, all of a sudden making wills and saying, if something happens to me, do this. That might be a hallmark too. And then taking great risk that could lead to death. Some people talk about driving too quickly or things that are just risky that are dangerous and reckless behaviors might be another warning sign. And talking about or thinking about death often is another thing that's cited. Or extreme mood swings, or making a plan or looking for ways to kill themselves. If somebody all of a sudden buys a gun, or if there's somebody who has chronic pain and they're stockpiling medications, you notice that they're saving their pills. These are things that are concerning. Talking about feeling great guilt or shame. And of course, Dr. Erica already mentioned substance abuse. These are all things that could be a hallmark of possible suicide that's impending.
I agree. And I think that thing that I would want your viewers and your listeners to walk away with. I mean, I live in Atlanta. If you're familiar with the public transit system, but it's a pretty common phrase, right? If you see something, say something. And I think that's really important for us not to fall back on being polite, but to talk to people, to notice things about people, to say things to people, people that are close to us, as well as strangers. If like, hey, looks like you're having a rough day. Is everything going okay? Just that little bit of a connection or communication with somebody. I think as Moody kind of talked about in his story too, that there is folks that are contemplating suicide, even those that have moved all the way to a plan and action, and they have intent and means, that they do reach out, and there is some kind of communication to others. And so there is that desire for connectedness.
Absolutely.
So.
For sure. Dr. A, you work with adolescents a lot. You work with college students and so forth. I want you to weigh in a little bit about what suicide looks like in this population and any difficulties or challenges that we might need to consider for our college students. Because a lot of times, even though suicide tends to increase with age, we are seeing a whole generation of younger adults who are feeling hopeless.
You know, when you said earlier, when you were talking about the giving the statistics, and you said that suicide is the 12th leading cause of death in the U.S., that statistics looks a little different for college students, because research shows that is the second leading cause of death for college students. And yet, you know, when I heard we were doing this, having this conversation, I kind of reached out to a few colleagues in different institutions and asked, what is your university doing as far as suicide is concerned? Very few universities have strategies in place to even have the conversations. Most of our universities have counseling centers. But suicide doesn't just affect the person who goes to counseling because they're feeling suicidal. Suicide affects someone who has suicidal ideations, but doesn't even have the words or the language or feels safe enough to talk about it. And so I think in our colleges, our college students, you know, the pandemic kind of shone a real big light on mental health issues than it was before. So a lot of things about isolation, depression, all of those things that we've talked about here was heightened because of COVID-19. And that leads to hopelessness. And we've seen that suicide is not just, like we were talking about, not just for adults, but even for kids. People hearing about it, and children don't have the language or the full understanding that death is permanent. And so a lot of the students who even start colleges at 17, 18, for them, this is a way of escape. I'm having a bad day, and so I don't want to feel bad anymore. They don't understand that death is permanent. So I think the way we deal with that population is, as I said today, have the conversations. When Moody was talking, I think the question you asked was, what's your personal suicide story? Those of all of us have professional stories, people that we walk alongside in our jobs.
Sure.
My story was a friend who, the day she decided to kill herself, was in my house and just came because we had talked, by, you know, knew she was struggling, told her, okay, what is your suicide plan? She had a suicide plan in place. And so the only thing was, okay, when you're going to do it, you know, don't do it alone. She said, well, you're going to talk me out of it. I said, no, I'm not going to talk. Nobody can talk you out of it when you've made up your mind this is what you're doing. I said, but I just don't want you to do it alone. And so it was so hard to sit with her in my living room couch, knowing she wants to take her life. Life was no longer worth living. She was hopeless. This was it. This was the day. And no matter what you said, what about the kids? Oh, the kids will be fine. You know, I didn't have a dad growing up and I was okay. My mom was, you know, everything you could say that would help put life in perspective wasn't. She was, this is the choice she made. She was going to do it. But, you know, the story ended happily because by the time we spent all night just together, I'm praying inside and I'm holding her and not saying you can't do this because I had promised her I wouldn't talk her out of it. But by the time morning came, things looked a little different. And there was a little reason for her to find that hope that she was missing. So I think having the conversation, and what we're doing here is really, really huge in trying to remove that stigma. When someone dies by suicide, I think even the words we use, when we say someone commits suicide, even using the word commit, into that stigma just a little bit. And so we can just start saying words like, you know, they died by suicide, and using words that removes the person from the diagnosis or the things that they're dealing with, it goes a long way. But having the conversation, even with kids, how are you feeling? You know, especially we know that suicide, the self-harm, the other things that kids do that just they want to relieve the pain a little bit. But having conversations with college students, with everybody about, well, how are you feeling? Do you have any thoughts of hurting yourself?
For sure.
And then we stop and we listen.
And we listen and intentionally, just like Dr. Eric was saying, not just asking and, you know, you're doing other things, but really intentionally listening. I want to bring up a subject with you all because we talk so much about how people find it uncomfortable to approach people about suicide and their concerns about their mental health. And we talk about how people who are feeling suicidal feel uncomfortable sometimes bringing it up. And what we haven't talked about is the fact that sometimes there are real ramifications in one's life about talking about suicide. For instance, certain professions, and I'm going to bring up medicine, certain professions feel completely unable to discuss suicidal thoughts. I know a lot of physicians have considered suicide, and we're going to talk briefly about that, and then I want to get your impressions on it, but would never say that they're thinking about it and would never seek help because there is a real fear of potentially losing their ability to practice. In fact, I'm so sorry.
No, I was just going to say, yeah, because you have to document, when you're renewing your license,
Yeah.
when you're getting, privileges and that kind of stuff, you have to state, what is your, have you ever, what your mental, situation is? Are you on antidepressants, medicines, things like that? So, you do feel like, wait a minute, now why are they asking me this?
Right.
What does this want to mean if I say yes? And actually, when I was in the military, there were consequences if somebody said yes to those questions from the standpoint they weren't able to be deployed, even though they could have been stable on the medicines and they were just antidepressants and that kind of stuff. But then it was like, oh, are they deployable? What's going to happen? And it would become such an issue. You would feel stigmatized and you wouldn't want to go and pursue treatment or help.
Wow.
Yeah,
That's
when
an
questions come
important
up, the
area.
questions come off as if they're caring, but it just makes our antennas go up.
Of
It's
course.
like, okay, however I'm hiding it, I need to put a little bit more makeup on how I'm
Yes.
feeling so I look a little less sad, mad, depressed, suicidal, just homicidal, name it.
Absolutely. Absolutely. As a matter of fact, talking about suicide in physicians specifically, physicians are at higher risk of suicide than the general population. In fact, roughly 300 to 400 physicians die by suicide each year. And in a 2022 report, they found that 1 in 10 physicians considered or attempted suicide in the year before, and 4% preferred not to answer. And we can all guess why that is, because of that retaliation or that fear of losing your ability to practice. Depression, emotional exhaustion, impaired relationships are some common causes that we see physician suicides. Now, in terms of physician suicides with female physicians, and we always like to talk about this, of course, being female doctors ourselves, we find that in the US, the death rates for suicide are 250 to 400% higher among female physicians compared to females in all other professions. And that's even when you kind of when you look at women who are matched with other doctorate degrees. So in all the doctorate degrees, PhDs and so forth, women physicians still have a higher rate of major depression and ultimately suicide. Unlike the general population, female physicians have rates of suicide that are equal to male physicians. So we briefly talked about how women have higher attempts in the general population, but males have higher rates of completion. This is not the case within physician populations. Women and men have equal rates of suicide. And then the last thing that I wanted to say is a word about medical students. Dr. Yolanda, you shared a story about an intern who killed himself. Medical students have rates of depression 15 to 30% higher than the general population. And as we've mentioned already, physicians experiencing suicidal thoughts are less likely to seek the help they need because the act of seeking help could jeopardize their ability to practice. One physician said, "I have little joy in performing the job that I believe I was born to do. Now, not only am I tired of work, I'm tired of life." Thoughts?
Of the physicians I know of that have ended their life, all have been female except one, which was the intern I spoke about earlier. And when you put so much of yourself into getting a terminal degree, MD, PhD, JD, all the Ds, when you put so much of yourself into getting whatever this is, you're not going to let anything stop you, including yourself, including I'm not well right now. But if I say anything, all of these years, all this work is going to be for nothing. and that breeding silence is dangerous. And if my voice is cracking, it's because of recently we lost someone, and her silence on this subject is I think it's why it ended up the way it did. And we can't keep being silent.
We can't. We can't.
Most definitely. I want to like speak on Dr. Yolanda. Like I said, and everything I was just saying, that's kind of like the mentality that I feel like we've been just brought up on. Even like in just being an athlete, you're not supposed to let anybody know that you're hurt. You might lose your starting position or something like that. And that's just the same cycle that we continue to do each day. It's like, you can't show you're hurt or you're going to lose something. Like what that's going to cost you is going to be way greater than anything. So just having that ability to speak up has just like already been taken from you. So, that's one of the things that, how do we get past that? I don't know, because like at the end of the day, I'm a realist. I know they looking at it business as business. They don't want to invest in anybody that's not going to be here 10 days from now. You know what I'm saying? They want somebody that's going to be here at least 10 years. So it's like they looking at that position. They looking at that. So, we say all that good it's all that good shit. But at the end of the day, it comes down to like, business is business. And so you gotta like still, come up to the work, get on the field, whether it's the medical field, athletic field, whatever the case may be. And you gotta get, like Dr. Yolanda said, we gotta put that mask on, put that helmet on, put that game face on, and go through it. But where is that gonna get us? Not nowhere.
Exactly.
You know what I'm saying?
Exactly.
Continue losing people on the field,
Yeah,
No.
I was going to ask you. I mean, like, how do we change that culture?
Well,
I think it's a culture.
There, I'd say about three things. One is that's one of the reasons there's been a lot of advocacy work with licensing boards regarding how they word those questions, because all of us that have been practicing a while have noticed there has actually been a change in the wording. So it's a little bit more flexible than it used to be, because everyone that's out there that's not necessarily a doctor, what potentially happens is then people have to go before boards, get interviewed, and basically either prove why they are fit to practice or go into programs afterwards to demonstrate their fitness. Number two is the issue that because of this fear of seeking treatment, you end up with people in crisis, and then we're having these questions of, well, what do you do and how do you protect yourself professionally if you get to a point where either you're a danger to yourself or someone else, or just can't take care of yourself? And part of the ways to move through this is really starting to educate and support each other and advocate so that people feel comfortable getting treatment on the front side when maybe you need a mental health care checkup or you're just a little uncomfortable or overwhelmed and stressed. I actually don't know a single doctor that's under the age of 80. I asked this question when I was talking, and I said, did anybody feel overworked? And it was a bunch of really senior doctors, and they're like, I'm fine working 80 hours a week. But most folks, almost everyone I talk to is totally overwhelmed, has been teetering on the edge of burnout, probably prior to the pandemic, but during the pandemic. But being able to seek support, even when it's not a crisis, and have people hold space for you is super important, not just for doctors, but for everyone. Because a lot of times the thing that's happening now is everyone's capacity is tapped. So the person you would typically call because you're struggling is on the struggle bus too.
Right.
So number one, there's the question of, should I call so-and-so? They ain't doing too great themselves. Or just them not being able to fully hold space for you because they're treading water. So one of the other solutions while we're working on that, especially when people are on the earlier side of the care model, is one of the reasons why people will go to practices that take cash. Because then there's really no, well, I mean, but if we're talking about doctors, it's very rare there's a doctor that couldn't move things around and pay cash. They might not want to. But I mean, it's one of the reasons a lot of us have these cash-based practices. My telepsych is all cash. It's all high achieving performers, professionals. And it's one of those things that then you don't have codes going places mysteriously. But the way around it is you pay cash. And the part of it is you get help early to ideally, hopefully not end up at these crisis endpoints. Naturally, there are some people that can have all the health in the world. They just got the bad end of the genetic stick and they're going to end up there.
Yeah.
But there are a lot of people that if they felt comfortable actually seeking help earlier, then we wouldn't have ended up at some of these endpoints.
For sure.
But there's a lot of advocacy involved. I know we all try to do some, but it's just difficult. And I think people with just the amount of stress and overwhelm in the pandemic are now getting to a point of just saying, forget it, I'm going to get help anyway, because it's just not sustainable.
Right. What do you all think? I'm especially interested in those who are big in the therapy part of it, talk therapy. There was a proposition, and I don't know where it went to in the space of things, that in certain professions, everybody should be mandated to have some amount of mental health therapy. That way you opt out of you only go if there's a problem. You don't have the stigma of, I went to see somebody, because everybody was asked to see somebody. And I think in some professions, they do that in certain instances. I know in law enforcement, if there's certain incidences that happen, you're mandated to seek therapy for a certain amount of time. But what are your thoughts about mandating it for populations through their employment?
It sounds great in theory, but we have a humongous workforce shortage. So it's one, I trained in an era right after the era where actually all psychiatry trainees, we all went into therapy. I trained right after that era. So actually in my cohort, a couple of us did therapy, but everyone didn't. But I think the difficult thing is balancing the availability with the need to mandate. I mean, I think there's some areas where people could, because if they hired someone specifically, and it's just hard to do it for everybody because there just aren't enough of us. And one of the things I see happen sometimes is when people come up with creative ways to solve these workforce issues, it ends up being people that are unqualified, taking care of poor and Black people.
Yes.
I think I just said that out loud.
Yes, you did. But I'm glad you did.
But I mean, I think
I'm glad you did, because it's the truth, and we keep it on.
Something I've advocated for is that when we're coming up with these creative workforce solutions, that they're ones that don't harm more than they help.
Fair enough.
And I'm sure Dr. Orr can also speak to the fact that the other issue is some people have access to therapy. And I've seen it happen with a lot of my patients that are using some of the app-based therapies like BetterHelp or something like that, that actually need a more sophisticated therapy like CBT or DBT or EMDR or something else. And their therapist is like, hey, how you doing today? How you feeling? How does that make you feel?
So
and
not the appropriate therapy then, you're saying?
Well, the thing is, sometimes people need something a little bit more sophisticated. And I think one of the things too is it's important for people to have access for those therapies, because, especially given the amount of trauma, there are some that are more evidence-based trauma therapies, which I'm sure Dr. Orr can also speak to, that it's not always just, hey, how you doing?
Well, I'll let Dr. Orr answer, and then I think Dr. A had a comment, and then we have to go to break. We're going to come back and talk about myths, Mythbusters. We're going to let you guys be Mythbusters. Dr. Orr, did you want to say something?
Yeah, no, I think Dr. Goodwin, I echo everything that she said so beautifully. It's wonderful that there's a lot of consciousness about mental health and a call for mental health. And we're kind of past the point of relying on institutions to take care of us. And so the next step is to figure out how can we in our communities figure out how to heal each other. And so demanding that institutions not keep all of these tools hidden or protected for just the few who happen to be able to afford them or gain access to them to utilize, but really starting to think about being more clever. Are there ways that we can train one another to just, as Dr. Goodwin said before, just listen, be present to someone, listen to what's going on with them. And when it comes to suicide and suicide prevention, for all of your viewers, broaching the topic's one thing, And a lot of people don't broach the topic because they don't know what to do if somebody says, yes, I am feeling suicidal. Like,
Yeah.
panic, what do I do now? And it's really simple. It's something that Dr. A talked about in her experience. You just keep the person safe for now. I'm just going to keep you safe for now. We think about it with addiction. Sobriety is one step at a time. Same thing. Moody talked about it too. It's not, suicide doesn't just disappear.
Right.
It's something that's always there, and you just keep the person safe for now. And that's something we can all do in our lives on a day-to-day basis with strangers and people we love and care about.
That's true. And I also want to make people aware of the crisis line, the National Suicide Prevention Lifeline. It's not only for those who are considering suicide, but they also have a resource for people who are worried about somebody else. So you can call that too if you feel like you want something more tangible, or if you don't have the capacity to just keep that person with you. Dr. A, you had a comment, and then we're going to have to see our viewers on the other side of the break.
Okay. I wanted to say real quickly that what you mentioned has a lot to do with workplace trauma, and is specifically you're talking about physicians, but most of the people in helping professions are dealing with it. And so in addition to what the other professionals say, it's us treating our own well-being as a priority. Because I think in your profession and in many helping professions, our focus is on helping others be okay. But are we okay? Are we investing in our own selves?
Good
And
point.
sometimes that may mean just creating your own safe space at work. There may be 2 or 3 of us that can get together and check in with each other, because, like Dr. Orr said, the institutions, the organizations, they're not invested in us being okay. But we need to make our own well-being a priority.
Absolutely.
Yeah.
Right. When we come back from our short break from our sponsor, one of our sponsors at SkinWorks, we'll talk about some myths about suicide. I'm going to let you all help bust them or tell us whether they're true. See you shortly. Okay, welcome back. We are here talking about suicide with When Docs Talk. I'm going to throw up a myth, and I want you all to weigh in on it. Is it a myth or is it a fact? So, only people with mental health issues commit suicide or have suicidal thoughts.
False.
Anybody?
Myth.
False. Myth. Myth.
Yeah.
Okay, it sounds like a resounding unanimous vote that this is a myth. And I can see why, because the truth of the matter is, first of all, we should acknowledge that not all people with mental illness consider suicide. And the flip side of that is that not all those who commit suicide have mental illness. There are people who may have no mental health issues. They may have chronic pain. And, we could list a whole host of things that could be the impetus for suicide that have nothing to do with a formal mental health diagnosis. So it sounds like everyone pretty much agrees with that. What about, we kind of already broached this already, but talking about suicide will lead to and encourage suicide. It will make people who are depressed get an idea of killing themselves.
Myth.
No? You're shaking your head. Moody, talk to me. Why don't you agree with that?
Because a lot of times that's what we want, just a conversation. Just kind of like, like that one statistic they said in the beginning, like 10% have thought about suicide. And I definitely call bullshit on that, because I haven't met a lot of people who haven't at some point thought, maybe not killing themselves, but definitely harming themselves to a certain extent. So it's just like, if anything, it would let you know that you're not alone, just like I said. So it's like not even bringing that conversation up is not as taboo as we like to make it out to be.
Fair enough. What about this one? So barriers to bridges, like literally putting up a barrier on the bridges that people might, jump off of, or safe firearm storage and other actions to reduce deadly methods of suicide can help to prevent suicide. What saith you, crew? Does it
True.
work? True. All right. True. Tell me, Dr. Erica, why is that true?
Well, the first thing is we're talking about a wide group of people. So the first thing is, if we think of young people, they're using things that are in the home, typically medications that were their parents, guns or firearms in the house. Part of safety prevention, when we have someone that comes to us that's having thoughts of harm, is part of the treatment plan is actually removing weapons, potentially even locking up knives and sharps, and having medication in lock boxes.
Okay. And that's kind of standard. It's the truth. So you guys, you answer that very eloquently. It seems common sense, and it is. It's true. Many times the decision to commit suicide is impulsive. So limiting access to lethal means such as firearms is one of the simplest strategies to decrease the chances of suicide. What about this one, guys? People who talk about suicide are just trying to get attention. I see everyone like, no. big heads turning side to side. Double thumbs down from Dr. Jonathan. Tell us about it, Dr. Jonathan. Thoughts?
No, it's not attention seeking. I think, as many of us have talked about already, that it's a topic that most of us would keep hidden because we see it as some form of weakness or something that we want to avoid, or again, back to that idea that we don't want to be a burden on another person. And so it is not attention seeking. In fact, most folks that are considering it or thinking about it will keep it hidden. And so you can't wait for someone to broach the topic with you. You need to be direct in asking and broaching that topic with another person.
Fair enough. What about this? Suicide does not just occur unexpectedly. There are often warning signs.
That's true.
True. Now, one thing I want to say about warning signs, we talked about them pretty extensively before. You all gave us some, and then we kind of had a list. I want to just bring up the fact that even though there are warning signs, I think it's important for us to absolve a lot of family members and friends of suicide from the notion that they should have known.
Right.
That is another reason why it's difficult for people to discuss suicide, not just because they're scared that their family member or friend will be judged, but also they fear judgment themselves, especially a mother. I've seen a lot of mothers, like, mother or fathers, parents whose children who have committed suicide, and they're like, didn't you see the warning signs? So there's a guilt that's inherently there. And so by providing these warning signs, we hope that it doesn't give the notion that if you missed an opportunity to stop a suicide, that there was something wrong that you did.
Can I say something real quick?
Please.
The first thing is I want to say that as Dr. A and Dr. Orr and even Moody alluded to earlier, there is one population of people that there's absolutely nothing you can do, that they are determined to die. And no matter what you do, it's going to be very difficult to stop it. The next is, I totally agree. It's a lot easier to talk about warning signs later than in the moment. So there may be times where something may be clearer when kind of the dust settles. So I do believe it's very important to not get wrapped up in a ton of guilt around this. I mean, I think this whole conversation is around giving people tools so that we could have more conversations and help more people. But unfortunately, it doesn't mean we'll be able to save everyone.
Absolutely.
Yeah, I agree. Go ahead. Go ahead, Dr. A.
Say also that just as people are different, the warning signs are different, and so I think that goes to, there are these warning signs, but it's not a one size fits everyone. Everyone is really different, and I think that helps with that guilt of saying, what did I miss? What should I have noticed? Surely there were warning signs. Everyone's
right.
Yeah.
Well,
I think this is really just a really important topic to talk about for survivors of those who have died by suicide. It's really important to let that guilt go, that they're not things that you'll see or connect. It's like someone who's at the scene of an accident and you say, well, didn't you know that car was going to run the red light? Didn't you see it 3 blocks before it hit your car? It's that same kind of it's kind of that ridiculousness to think about, well, why didn't I see the signs? Why didn't I see these things? And it's back to Dr. A's recommendation to change our language around died by suicide as opposed to committed suicide, right? That
Yeah.
there's not this secret formula that we can figure out before, or a magic 8 ball that we can say, I think this person, yep, they're going to die by suicide. It really varies for each person. And for those that survive, it's really difficult because we don't have answers.
That's
We
right.
don't really understand or know. We can't find out from the person, what were you really thinking? Was this something that you really wanted to do? Because many of the pieces of research that's been done with folks that have survived suicide attempts have decided at the very last minute to live. And so they happen to make it through. And so for many who do end up dying by suicide, they still had that piece that they wanted to live and just ended up completing. And so it's to let our guilt go and recognize that this is something we can't control.
I love that. I want to start off by saying that I really have enjoyed having this conversation with you all. You all have given me personally language to discuss this issue a little bit more comfortably because it is an awkward situation and discussion for a lot of people. I want each of you to just drop a line or two last minute pearls with our viewers. What last minute thing do you want to leave with our viewers, Dr. A?
I want to say that you are whether suicide is something you're thinking about because there doesn't seem to be any other way out. You see it. Sometimes we feel as if, or people who die by suicide feel as if this is the best thing that I can do. I'm a burden to my family. That your family hurts more when you're not there. And so if you are hurting, like all through the show, we've put up phone numbers that you can text, the hotlines, all of them, helplines are there. There's a place where you can call. Don't even have to give any information about yourself, but just let them know what's going on so someone can walk alongside you. And if you are someone that's dealing with the after effects, you've had a family member that has died by suicide, we see you as well. We know that grieving a loss of someone looks different when you're grieving the way that person left you. But it's okay. There are also people that you can talk to. So I guess my last sentence is you don't have to go through this alone, whether you're thinking of suicide or whether you're dealing with the after effects of it.
Thank you so much, Dr. A. We appreciate that insight. Dr. Erica, what are you leaving with our viewers?
I'd leave with 3 things. One is that there's still hope. And as humans that walk this journey together, sometimes our purpose is to hold on to hope until others can hold it for themselves. Number 2 would be that if you or anyone you know is struggling, get help early. These kinds of issues with mental health, it's the same as with like diabetes or hypertension. If your blood pressure is up, just a little bit of diet and exercise change may fix it. But if it gets really janky, you might have a stroke. So this is one of those things to get help early. The third thing is if you are supporting someone that's struggling, to be present in the process of helping to give them help. They may not have the mental capacity to start doing all of these lines and calling all these people. And all of you all out there should probably know that actually finding a mental health professional outside of an ER or something like that can be a little bit complicated. So actually being present and helping them through that process. If you all are interested, I can send you the information. There are 2 other crisis lines that I think are really helpful. So I'm sorry, this is 4 things. There is a veterans crisis line. I'll shoot you all the website because they have a chat, they have a text, and they have a call line. The thing I love about the veterans line is it's very geared towards veterans and also then syncs up with veterans resources, including the VA. SAMHSA also has a line that can also help with substance abuse. In addition, I can send you both of those. And thank you so much for having me.
We are so blessed to have you. And if you send those to me, I'll make sure to put them up on our website, both on Facebook, Instagram, and on YouTube for our viewers. Thanks so much, Dr. Erica.
Thank you.
Dr. Jonathan?
I think I would, kind of picking up on Dr. Goodwin's comments, It's not always a mental health issue that leads someone to contemplate suicide. Sometimes it's a financial crisis. Sometimes it's potentially failing a class. There's other resources. And so, in addition to those lines, it's good to know the United Way has a resource line that you can call for any number of community resources. It's 211 is their community resource. So if you're connecting with someone who might be thinking about suicide or considering suicide, that it's a good way to just consider how can you resource them just to keep them safe for now. And the last thing I would say is be curious about other people. If you see something, say something. Look for connection because connection saves lives.
I love that. Be curious, be interested. Thanks so much, Dr. Jonathan. Moody, talk to us.
Most definitely. One thing that definitely just stuck out to me that's really placed on my heart right now is, like you said, for you as physicians, just not being able to have that voice to speak up whenever y'all want to say things. So for me, I really want to speak directly to those physicians or those in position that feel like they can't use their voice in order to ask for the help due to the fact that they're afraid of losing their job or anything that's of that matter. You'll figure it out. Like I said, you didn't get to your position in life by just getting by or anything like that. I understand that a status in a certain class is something that's big in this world that we live in. But, at the end of the day, that status, that class, that job don't make you. So for those who are out there that feel like they can't speak up due to whatever they feel that they're going to lose, whether it's their job or even a person or someone or a companion of that sort, just be fine with knowing that, whatever comes after that, you'll be able to figure it out. That's one of the things for us, like prevention, that, being able to be with yourself and learn how to be content with yourself alone, do that work early. I'm all about being proactive instead of reactive. So if anything, like I said, if you're at the point that you're already contemplating suicide, instead of searching for someone to get that feeling from you, just start working on yourself, start looking at where is this coming from, seeing where you can grow from there. And for those who are in with someone who may be contemplating suicide or they haven't yet identified, start working on yourself as well. I think it all starts with everyone takes individual responsibility. We talk about love languages, but let's talk about help languages. Learn how you can help, learn how others can help, how they need to be helped as well. So once we start putting that time in our own self and everything that we're doing, when I feel like we put that self-work in, it'll just flourish out. Because we're all the same, whether we believe it or not, we're all so much the same. And there's nothing that we're going through alone. We're so connected in different ways. Just as much as I am an advocate now, I was just one who was contemplating suicide. So I'm still the same person in both factions, but it takes knowing that.
I love that. I love that. Help languages. I love the fact that you changed your life around and now you're an advocate and you can really support others. That's an amazing story. We are so fortunate to have you. Thank you so much for joining us.
Most definitely. Thank y'all so much.
All right. So I want to thank our guest and I want to bring on our host for our last minute words to our viewers. For those of you who have been along with the ride for this whole show, all 1,000+ of you, thanks so much for watching our daily prescriptions. So, ladies, what are we leaving with our viewers? You're on mute, hun.
Oops. No, I was going to say it was so much. I mean, it's so much to swallow from the standpoint, just the information that we got and the expertise that we got. But even just the help language, but also just the level of being present. Yes. And especially within our communities. I think that's really key. I always think about how daunting our mental health resources or the lack of mental health resources that we have here in Georgia, and even trying to get people to where they need to be. There's no appointments and things like that. But really going back to that sense of community, that sense of village and that help language and being a little bit more present for people and our colleagues, our friends, just being a little bit more aware, like in the midst of all the craziness and that kind of stuff, being able to stop and just say, you know what, listen, let me just be a little bit more present if somebody needs us. Or even if it's just a hug. And my cousin, she loves to give hugs. So she was like, give them a hug. But really, I mean, sometimes maybe that's all somebody needs for that moment. And also just thinking about the moment at hand, not necessarily long term. How am I going to help? Just, hey, maybe in this moment, I just need to be there and just
Yes.
give them a hug and help them.
Absolutely. Thanks so much, Dr. P. Dr. Yuli, words for our viewers. This is a tough one, I know, this episode. You're on mute.
Look, I was talking about you being on mute. Now I'm on mute. Taking a moment, I can think of various times in my professional, my personal life where I've just taken that moment where I might have been doing 5,000 things at once. And, my son is jumping off the couch and my daughter's got a dirty diaper and the cat's trying to kill me. And someone calls and it's like, God, I haven't heard from this person in forever. I'm gonna have to call them back. You know what? No, I'm gonna pick up the phone. They're gonna understand that this baby's hollering in the background and whatnot. Things like that, just doing that type of thing in your everyday life, I feel like is preventative, it's helpful, and sometimes it's the lifeline. You're throwing out a lifeline you didn't know somebody was even reaching for. So just taking that moment, I think is so important. And I want to thank everybody on the stage and everyone watching who has ever thrown out that lifeline, or even if you were courageous enough to pull on the lifeline you got.
Absolutely. I love that.
Yes.
So we talk a lot about human connections. Moody was talking about we're all alike, and it's true. I don't care if you're Black, white, Asian, woman, man, older, younger. There is commonality just because we are humans. And recognizing that commonality is one of the most important things. So when we recognize that we're all kind of in this same boat together, whether we like it or not, we're in it together. I think that's going to be the first step. The second step is not being silent. We've talked about this ad nauseum, but I'm going to say it again. When you recognize something, call it for what it is. Don't be so scared of offending somebody that you miss the opportunity to save their lives. I'd rather you be offended by me. You can hate me all day if I can hug you tomorrow. And so I'm going to make that my personal mission, calling on things that I notice that I'm concerned about. If it's no big deal, it's no big deal. But this is a real thing. It affects us all. And I want us physicians to take a little bit better care of ourselves.
Yes.
I want to normalize in the Black community seeking help for anything mental health and not seeing it as a weakness. And I want everyone who's watching to leave this knowing that there is strength in recognizing that you have a problem, and there is strength in seeking help. It does not make you weak. I want people who have attempted suicide to know that you can be a resource for others. And if you're feeling like slipping again, there are resources still for you. And I want to thank everybody who has watched this episode, who has commented, who has supported. I hope that we have shared with you something that you can use to save somebody else in this boat of life. Thank you so much for watching When Docs Talk. I'll see you next time.
When dogs talk, when dogs talk, when dogs talk, when dogs talk. When dogs talk, when dogs talk.